and unwavering support for women, children, and vulnerable groups continue to inspire hope and ignite positive change. Gombe State is truly honored to host you at this occasion, which is the very first one. This summit also provides us an opportunity to spotlight the commendable strides of the Gombe State government under the able leadership of His Excellency, the Executive Governor, Muhammadu Inuwa Yahaya, CON. From the remodeling and upgrading of the State Specialist Hospital, revitalization of all primary health centers, upgrading of general hospitals, establishment of a contributory health scheme serving more than 100,000 people beneficiaries today, to the remarkable reduction in maternal mortality. The record speaks volumes of a state that is walking the talk in the health sector reform. Your Excellencies all, distinguished guests, colleagues, ladies and gentlemen, today's summit is more than an event. It is a clarion call for sustainable financing, for stronger partnerships, and for collective action to ensure that quality health is not a privilege but a right for every citizen of Gombe State and indeed Nigeria at large. With utmost gratitude to God, with humility, I welcome all of you once again to this historic occasion, and may it be a springboard for better things that will happen across all states in Nigeria. My name is Mojima Konjola. This is a welcome for me. This is not the first time in Gombe State, but Gombe State continues to excite me for the things they are doing. I therefore would ask that we put our hands together for a state that is performing, for a state that is walking the talk. Thank you very much. Immediately now, I'd like to invite the Secretary to the State Government to give a welcome address. Please, can we just put our hands together to have the SSG welcome us.
Thank you very much. Your Excellency, the Governor of Gombe State, Muhammadu Inuwa Yahaya, CON, Ramajan Gombe, Chairman, 19 Northern States Governors Forum, and the chief host of this event. Her Excellency, Senator Remi, Remi Tinubu, wife of our President, First Lady of Nigeria, and the mother and mama of the Federal Republic of Nigeria. Your Excellency, Deputy Governor of Gombe State, Manasseh Daniel Jato, PhD. Your Excellencies, the wives of governors from not less than 25 states, distinguished senators of the Federal Republic of Nigeria, serving and former, the Right Honorable members of the Federal House of Representatives, serving and former, the Honorable Coordinating Minister of Health and Social Services, Professor Muhammad Ali Pate, other respected ministers of the Federal Republic here present, the Right Honorable Speaker, Gombe State House of Assembly, Honorable Abubakar Lugerewol, and other members of the Gombe State House of Assembly, respected ministers of the Federal Republic of Nigeria, permit me, Your Excellency, to respectfully observe the well-laid out protocol by our sister and adopted daughter of Gombe State, Mojima Konjola. It is with utmost humility and deep sense of purpose that I welcome you all to this memorable occasion of the Gombe State Health Summit 2025. This historic event, which has in attendance experts, policymakers, and stakeholders in the healthcare sector, is a testament to the importance we place on the health and well-being of our citizens. This is the 5th gathering of this nature, having hosted the first investment summit in 2022, first and second security summits in 2022 and 2025 respectively, and the Gombe State Local Government Summit in 2025, early this year. And today, by the grace of Allah, we are hosting the Health Summit, being the 5th in the series. You will agree with me that His Excellency Muhammadu Inuwehaya is solidly on track to deliver Mr. President's renewed hope agenda in Gombe State. The theme of today's summit, transforming the healthcare system in Gombe State, accomplishments, challenges, and the next frontier, is both timely and relevant. It reflects Governor Muhammadu Inuwehaya's commitment to self-evaluating the progress and milestone achievements, identifying challenges, improvement, and charting a course for future growth and development in the health sector in Gombe State. There is no gainsaying the fact that administration of His Excellency Muhammadu Inuwehaya Ramajan Gombe has made significant strides in improving healthcare delivery in Gombe State. I make bold to state that Gombe State government has expanded healthcare services to all parts of the state, particularly in the rural areas, by improving access to quality healthcare for our citizens. The government has also invested heavily in modernizing our healthcare facilities and providing the necessary equipment and technology for the enhancement of healthcare services to the people. Your Excellencies, distinguished guests, ladies and gentlemen, these accomplishments, and indeed the adoption of key health policies and reforms, have contributed to the improvement of the healthcare status of our population throughout this. Despite of all these milestones achievements, we humbly noted that our healthcare sector needs view the resources available to government. It is imperative that as we look to the future, we must prioritize innovative solutions to address the challenges facing our healthcare sector. We need to leverage technology to improve the healthcare delivery, including telemedicine and electronic health reforms. These needs assessment warrant the convening of a health summit where experts will proffer solutions and help to chart the roadmap to obtain desired results in keeping with the renewed hope agenda of Mr. President, Senator Ahmad Bola Tinubu, CFRL. Permit me to share with you the sentiments of my governor, His Excellency Muhammadu Inuwehaya. I would like to emphasize and bequeath the transformation of our healthcare system in line with Mr. President's renewed hope agenda to make our citizens to take ownership and take greater responsibility for their livelihood. I foresee that this would require the collaboration and commitment of all stakeholders, including government, health worker professionals, civil society, and the private sector. I'm therefore confident that this summit will provide a platform to stakeholders to share ideas, suggest strategies that would improve healthcare service delivery in Gombe State, as earlier mentioned. In conclusion, let me appreciate the consultants of this summit and indeed the organizers for an excellent work of organizing this important event. On behalf of His Excellency, my Governor, Gombe State, and government and the entire people of May Allah bless you and prosper you as you sacrifice your comfort for all of us in Gombe State and Nigeria in general. Thank you. Welcome once again.
Thank you very much, the SSG. The excitement in the room is the commitment that has been shown, and it is when you go around yourself to see, you'll know it is not about just doing the talking. I was taken around yesterday, I've seen some of the facilities, and they do exist. But for now, we would skip, if you don't mind, we'll skip the goodwill messages and of course the documentaries which you'll see later on. But we'd like to acknowledge that we have, that has been working with us from the development partners, from the UN body, the Aliko Dangote Foundation, the Saif Advocacy Foundation. We also have the Gates Foundation that have been working hand in hand for this to come into existence, and of course the World Bank too. We're moving forward now. If there's a man who believes that health is not about Abuja, health is about cascading it to the states and the states embracing health as a developmental issue, is our coordinating Minister of Health, my brother, Honorable Minister, Professor Mohammed Party, who would now speak to us.
Thank you. Excellency, the First Lady of the Federal Republic of Nigeria, Senator Remi Tinubu, CON, His Excellency, my senior brother, the Executive Governor of Gombe State, Ahmadu Inu Ayaya, CON, Her Excellency, my own brother, the Honorable Minister of Education, Dr. Tunji Alausa, the wife of the Speaker of the House of Representatives, wives of governors that are here, the Speaker of the Gombe State House of Assembly, Secretary to the Government of Gombe State, the members of the Gombe State Executive Council, especially my own dear brother, Dr. Abu Dahiru, the Commissioner of Health, all other senior dignitaries of Gombe State, our Royal Father, the Michael Chingo, who is here, my own Permanent Secretary of the Federal Ministry of Health, and directors of the Ministry, Director Generals of Primary Healthcare, NHIA, Blood Transfusion Agency, and all other senior officials that are here, wives of ministers, other senior officials that are here. And I would like to appreciate my own teacher, Professor Al-Hassan Melaya Kubu. I'm not sure if he's here, but at least I'm here in Gombe, I have to acknowledge him. Distinguished ladies and gentlemen, I will be very brief. I think we'll start by thanking His Excellency, the Executive Governor of Gombe State and his team for the very warm welcome, for hosting this Gombe Health Summit and inviting all of us to participate in their dialogue that is important about the health of Gombe State, this region, and also our country. Your Excellency, thank you to you and your team for the excellent convening and the constructive dialogue that we are going to be having here. We appreciate it very much. I also would like to thank Her Excellency, the First Lady, for her tireless efforts in advancing anything that has to do with the health, well-being, the social transformation of our society, particularly for those who are poor and vulnerable in our society, women, children. So, Your Excellency, we thank you for all your effort and your generosity, as well as all those who are supporting your initiative, the Renewed Hope Initiative, which is transforming and touching lives in our country. I think this summit is coming at a very good time. 2 years ago, we know that His Excellency, Mr. President, unveiled his Health Sector Renewal Investment Initiative. That came at a time when Gombe State has already, I think from 2019, was in its move to transform its healthcare system. We acknowledge that Nigeria's health can only get better if federal government works with states, local governments, private sector, civil society to advance the needs of our own population. Building primary health care, building affordability through expansion of health insurance, qualitative hospitals, building human resources. 2 years down the pike, I think we can all acknowledge that the transformation that Mr. President envisioned, and with the support of all our state governors, and with support of private sector, traditional leaders, and all other actors across sectors, we're seeing the beginning of that transformation unfold. And here in Gombe, I do believe that we are seeing that transformation in real time, because I know that service delivery has increased. Primary healthcare centers have been revitalized. Almost 100 primary healthcare centers have been revitalized recently in Gombe State, in collaboration between the state government, impact, and the federal government. And thousands of women have received emergency obstetric services, support from the federal government's intervention in that direction. There are many interventions, including human resources. Thousands of frontline health workers retrained in collaboration between the federal government and the state government. This is an example. But beyond that, we know that there are homegrown solutions that Gombe State has also created. The human resource management that you in Gombe State piloted is now a beacon of hope across our country in terms of how to harness and manage the human resources that is available in our healthcare system. And that's an example that other states, I believe, will benefit. And this summit provides an opportunity for us to be able to learn how you are able to do it. You've invested more resources domestically towards healthcare services. That's an example. And we know that the federal government has also, under the leadership of the president, invested more domestic resources towards health, education, and other social sectors. But at the end of the day, improving population health outcomes is not only about the healthcare system. There are many other determinants that affect who gets better, who gets well, who survives, and who doesn't. Education is key to that. Education of girls and girls staying in school. Water and sanitation, agriculture and nutrition. The multi-sectoral determinants of health are also important. That's why what you are doing, Your Excellency, I think is worthy of studying. What Her Excellency is also doing through the Renewed Hope initiative, I think it's bringing that perspective, a multidimensional approach to reducing poverty and to ensuring that every life gets the opportunity to survive and thrive. So we thank you, Your Excellency, and we wish you all a very successful summit. Thank you.
We thank you very much, the coordinating Minister of Health and Social Welfare, summing it up there. In 2019, we had a program going around the states, particularly northern states, on malnutrition in children. At the end of 3 years of the study, I was a member of that team. And without any argument, the governor of Gombe State was decorated as the nutrition champion for these states. So the multi-sectoral approach is what the minister has spoken to, and that is the way of Gombe State. It is in light of this that I'd like to invite Your Excellency, the Executive Governor, to please address us. Going around Gombe State, you will see that he's walking the talk. Gombe State Governor, please, Your Excellency.
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Your Excellency, the First Lady of the Federal Republic of Nigeria, distinguished Senator Remi Tinubu, GCOA, my dear wife, Your Excellency, the First Lady of Gombe State, other excellencies, wives of the governors that are here, Your Excellency, the wife of the Speaker, the Deputy Governor, Right Honorable Speaker of Gombe State House of Assembly, Honorable Member, House of Representatives, I beg your pardon, Honorable Usman Bello Kumo, the Chief Whip of the House of Representatives, Honorable Ministers, especially my dear brother, the Honorable Minister for Health and Social Development, members of the Gombe State Executive Council, heads of security agencies here, chairmen of various local governments, our royal fathers, especially Zeme Kaltungo, heads of other agencies, especially the federal agencies that are here with us, heads of development partners, and senior executives of government at various levels, distinguished invited guests, members of the press, ladies and gentlemen, a very good afternoon to all of us. Let me begin by welcoming Her Excellency, the First Lady, to Gombe State, and to thank her for accepting to declare the first ever Gombe State Health Summit open today. I would also like to welcome all other distinguished personalities, especially development partners and stakeholders that are here with us physically and those that join via virtual platforms. I'm highly delighted to see you join us today as we share our journey of transformation in the health sector of Gombe State, a journey that began in 2019, that has been marked by profound challenges, yet fortified by our unwavering commitment that has seen the state become a model of effective healthcare reforms. When I assumed office in 2019, I was confronted with a sobering reality in the health sector. The system was weak, underfunded, and overwhelmed. Only a mere 3.5% of the state's total budget was allocated to health, far below the Abuja Declaration's target of 15%. And nearly all available health infrastructure were dilapidated, and human resource was poorly trained and ill-motivated. And in addition, also it was unevenly distributed, while absenteeism was rampant. Access to health care was largely determined by ability to pay, and there was no mechanism to protect the poor and vulnerable, thus resulting in low utilization of essential services. Regrettably, lack of executive oversight combined with fragmented donor coordination resulted in inefficiencies that severely impacted service delivery. As a result, all our health indicators were below the national average. According to the National Demographic and Health Survey report of 2018, percentage of children with full immunization was only 18%. DPT-3 coverage was 26%. Only 21% of deliveries were attended by skilled birth attendants, and use of modern contraceptives by women of childbearing age was only about 16%. It was therefore not surprising that when we conducted a needs assessment in April 2019, prior to assuming office, access to good health care emerged as the topmost priority for our people across the 440 communities where the survey was conducted. That cry became our mission, and therefore when we took office the following month in May 2019, a state of emergency was declared in the health sector. The declaration was not merely symbolic. It marked the beginning of a transformational era as we prioritize our investment in high-impact interventions, which enable us to make the progress that we are celebrating today. The results of the 2023 National Demographic Health Survey reflects the positive outcomes of our deliberate and targeted initiatives. While there is a general improvement in most of our indices, some have more than doubled from 2018 to 2023. For example, percentage of children fully immunized increased from mere 18% to 49%. DPT-3 coverage increased from 26% to 60%. Delivery by skilled attendants increased from 21% to 38%. And modern contraceptive use rose from 16% to 30%. At the high-level roundtable of PHC convened in Seattle by the Gates and Aliko Dangote Foundations in November 2019, I made a personal commitment that Gombe State would no longer outsource its responsibility, would own our health reforms step by step, no matter how tough the journey is. We adopted a holistic approach with incremental investments over time in critical areas of need, while ensuring an efficient use of our meager resources. We increased health sector budgetary allocation from 3.5% in 2018 to 12% in 2025. And that has been backed consistently by releases over the last 5 years. And a 5-year emergency health sector response was developed that was aligned to our 10-year development agenda, which is the development agenda for Gombe State, which has been aligned to the Sustainable Development Goals and which we target to achieve all the Sustainable Development Goals by the year 2030. Your Excellency, permit me to highlight some of our notable achievements in the health sector over the past 6 years. In primary health care, we have revitalized a total of 228 primary health care centers, which is equaling 2 functional facilities per political ward, because we have 114 political wards in Gombe State. These PHCs now offer 24/7 services, meaning they operate 24 hours throughout the week and are fully equipped with solar power, dedicated boreholes, and staff quarters. We established a state task force on primary health care and immunization, and it is chaired by the Deputy Governor himself in order to ensure rigorous oversight, and that led to expanding access to immunization by increasing service delivery points from 323 to 540 facilities across the state. We strengthened community mobile teams for outreach and introduced technology for service monitoring. We improved efficiency by implementing direct e-payments to logistics teams. We boosted frontline manpower by recruiting and deploying 440 community health workers to underserved areas through partnership with the Global Alliance for Vaccine and Immunization, Gavi. We deployed an additional 145 midwives to primary health care centers across the state through the basic health care provision. In secondary health care, we upgraded and modernized, remodeled and equipped 1 general hospital in Kumo, which is in the central, 1 in Bajoga in the north, and serve as referral centers for our PHCs. The transformation of Gombe Specialist Hospital has yielded unprecedented results. It secured accreditation to train house officers for the first time in its history and has so far trained over 100 house officers. By matching consultant salaries with that of the federal government, we've retained a record 16 consultants of the payroll of Gombe State, which directly enabled it to secure accreditation for postgraduate residency programs in family medicine, obstetrics, and gynecology. The old general hospital in Kumo was demolished and a brand new, fully equipped 250-bed modern hospital was constructed by the state government and graciously converted to a federal medical center by Mr. President, which will be commissioned later today by Her Excellency, the First Lady. We established a hospital's management board for effective oversight and prompt staff promotion. That happened because by the time I assumed office, it was only Gombe State out of the 36 states of the Federation that did not have a hospital's management board. In order to eliminate ghost worker syndrome and reduce absenteeism of workers, we introduced a biometric attendance system that exposed 440 ghost workers and saved us 4.5 billion naira. We constructed staff accommodation and implemented salary adjustments to enhance staff retention. We constructed a new 1,000 student capacity college of nursing and midwifery in order to produce more skilled health workers for the state. And that will be commissioned by Her Excellency tomorrow, inshallah. We established the Gombe State Contributory Health Scheme, Go Health, so as to reduce financial barriers for residents. Go Health has so far enrolled over 380,000 residents and provided access to health care for over 100,000 vulnerable individuals across the 114 political wards of Gombe State. We established Go Pharma on a PPP arrangement that can supply pharmaceuticals and other equipment and drugs necessary for the operations of our health system. And that we do at a lower price from what obtains in the market. Our long-term vision for Go Pharma includes local production of pharmaceuticals within Gombe State. Already, Go Pharma has acquired a site at the Dadunko Industrial Park, and very soon they will commence construction. We constructed two additional pharma-grade warehouses to expand logistics and storage capacity at the state's medical store. All these efforts, from revitalizing our primary healthcare centers and modernizing our secondary facilities to establishing Go Health Scheme and Go Pharma, represent the deliberate creation of a seamless, comprehensive healthcare ecosystem in Gombe State. This integrated system is designed to deliver quality care from the primary to the tertiary level, ensuring that no one is left behind. And by the grace of God, we shall attain that with the operation of the Federal Medical Center, Kumo, and the Federal Teaching Hospital, which the federal government is directly supporting and funding, and which are being expanded by the day. To strengthen our commitment to the welfare of health workers that power this system, I'm pleased to announce the immediate approval for the full implementation of CONMES and CONHES salary structures for all health workers, effective November 2025, making them at par with that of the federal government. This significant intervention is financially going to cost 253 million naira monthly on top of the payroll of Gombe State. And that translates to 3 billion naira annually. In return, I call upon all health workers in Gombe State to match this commitment with renewed dedication, higher standards of productivity, and an unwavering focus on contributing to the health and well-being of the people. We delayed paying conmates and confares for several reasons. Ordinarily, if you pay salary in a situation where there is no environment for them to go and do the work, it turns out to be a useless venture that will yield no result. But at this point in time, we've done the basics, and I believe that complemented with efficient and effective service from the workers will boost the healthcare system in Gombe State. Recognizing that true health outcomes extend beyond clinical care, our administration has made foundational investment in other enabling sectors. The Network 11100 program, for example, is an initiative that provides 100 kilometers of road network, intra and inter within the state, for all our 11 local governments. Thus, 1,100 kilometers in 11 local governments. We have achieved that. As at the last count, 920 kilometers of road networks had been done in Gombe State. Therefore, reducing, the need for people to pay extra or suffer or even delay taking the sick to the hospital, especially mothers that are about to deliver. To combat malnutrition, we launched an innovative partnership to produce and train mothers in preparing nutritious homegrown food supplements. That we did when we saw that we had to rely on UNICEF to provide the food nutrition supplements. We resorted through our Ministry of Science and Technology. We got to the NAPRI at ABU Zaria and collaborated and provided the formula using the basic food ingredients that we have here. We've already gotten the patent and we have gotten approval by NAFDAC to produce it in commercial quantity. So we shall be selling. And we have cascaded by going to the nooks and crannies. All the local governments, women have been trained in order to produce that. So meaning commercial enterprise will develop within our women folk, and that will empower them and provide them their means of livelihood. We equally constructed 1,800 classrooms and reintegrated 350,000 out-of-school children, thus ensuring a healthier and a more prosperous future for all. As at today, we have not yet reached our target. There are, by the UNICEF estimation, about 750,000 out-of-school children. But with our effort, inshallah, very soon we shall overcome. And I pray that parents, and especially the traditional leadership, will pay special attention to that, so that at the end of the day, we'll be able to take all the children back to school and ensure that they are educated and they become productive in order to develop our country and the economy. As we reflect on this journey, let us remember that these reforms are not just about statistics or systems. They are about the lives changed, the families strengthened, and the communities empowered. We have demonstrated that with a clear vision, commitment, and accountability, change is possible. But we are not yet where we need to be. The journey is not just about numbers. It is about the woman in Doku, who now delivers her child in a safe and clean facility. It is about the child in Balanga who receives his vaccinations on time. It is about the father in Funakai who no longer sells his farm or all his produce in order to buy medications. For us, health is not just a social service. It is the foundation for productivity, prosperity, and dignity. The road ahead is still long, and the work continues. Together with our partners, especially with the support of the federal government, we remain committed and determined to build a resilient health system that leaves no Gombe citizen behind and no citizen of Nigeria behind. That is in the spirit of the efforts of Mr. President through the Renewed Hope agenda. And I believe that is the mission of High Excellencies today by coming to Gombe State. I thank you all for listening. God bless you all. God bless Gombe State, and God bless the Federal Republic of Nigeria. Thank you.
He deserves a very loud round of applause. Walking the talk. I can see excitement from him, delivering on what he's been able to do and accomplish. As we look at the theme of the conference of the summit, Transforming the Health Sector in Gombe State, accomplishments, challenges, and the next frontier. Thank you. As we settle down, Your Excellencies all, Your Excellency, the Mother of the Nation, and indeed the promoter of health, education, agriculture, economic empowerment, social investment through her Renewed Hope initiative, I'd like to welcome her, yes ma'am, to declare the summit open and of course make public the publication on Health Work Strategic Development Plan of Gombe State. Your Excellency, you're welcome.
Thank you very much. Can we all be seated? Which of the mic am I using? This one is in my face instead of in my mouth. Can you bend it down a bit? Just it's on my face. I want to look at people. Thank you. Thank you very much. It is good, indeed good to be in Gombe. This is my first visit. And I'm already loving Gombe. I told His Excellency today, I said I would have made my trip 3 days instead of the 2 days. Because to be honest, I didn't know I would be doing, there's a health summit going on. They told me it's commissioning, that you just commission and go away and move on to the next. But this is big, so may Allah help me today. The wife of the Speaker, House of Representatives, Hajia Fatima Tajuddin Abbas, wife of the Deputy Senate President, Hajia Leila Barau, and wives of National Assembly members here present, our governor, our host today, the governor of Gombe State, His Excellency Alhaji Muhammad Inuwa Yahaya. By the way, Mr. President sends his regards and love to you. And he said you are really doing a good job. And for what I've learned in just these few minutes, I can attest to that. And the First Lady of Gombe State, Her Excellency Dr. Asmau Inuwa Yahaya, the First Ladies of other states present, members of the National Assembly, both the serving and former members, including the Chief Whip of the House of Representatives, Honorable Usman Bello Kumo. Thank you so much for all the efforts you made for our team to be here. The Deputy Governor of Gombe State, His Excellency Dr. Manesa Daniel Jatau. The Speaker, Gombe House of Assembly, Right Honorable Mohammed Longerewu, did I say it right? And other members here present. Honorable Ministers present, I would particularly like to recognize Professor Muhammad Ali Pate, CON, the Coordinating Minister of Health and Social Welfare, and also the Honorable Minister of Education and the former Minister of Health for State, and now the Honorable Minister of Education, Dr. Tunji Alausa, CON. Have you received your own yet? CON, wives of honorable ministers present, wives of service chiefs, members of the Gombe State Executive Council present, including the SSG, Professor Abubakar Unjodi, and all others. The APC Deputy National Woman Leader, Hajia Zainab Ibrahim, traditional rulers present, members of the health sector, gentlemen of the press, distinguished ladies and gentlemen. I am indeed honored to be here at the first Gombe State Health Summit 2025 with the theme Transforming the Health System in Gombe State. Accomplishments, challenges, and the next frontier. I didn't have a prepared speech, but I've listened intently to all the speakers. I know my job is simple, just to declare this summit open. But before then, I want to really commend the governor for transforming the health sector in Gombe State. I know it's the usual statement to say a healthy state or a healthy nation is a wealthy one. And you've done that, and you said today that health is no longer just a necessity, but a place where you can enhance productivity, if I heard you right, prosperity, and human dignity. And I believe you've captured all of this. And I say well done and kudos to you, sir. I heard all the transformative and transformational trailblazing strides that you have taken in the health sector. I can't begin to lift them. Is it in the primary health centers that you have increased, or the various hospitals the state hospitals that you have put in the 3 senatorial districts? I listened how you wanted to even enhance nutrition in children through homegrown approach, and also producing pharmaceuticals too. Is that not what I think I heard a lot? You have so much robust agenda for the health sector, and I can't help but applaud you today. You've done so well, and it's just very sad for me to just come in and just leave without really having the opportunity to look at the various approach and strategy you want to use to move your state forward. To what I've learned so far today, even Bill Gates attested to that. He said he was impressed by Gombe's problem-solving mindset and commitment to achieving results. And we see that today, and we say we are really proud. I believe that Mr. President is also proud of what you are doing. And also increasing salaries, it's really wonderful. And most people didn't realize that the state allocation has been tripled. And you are really putting yours to very, very good use. And I believe that's why when I told Mr. President this morning, he said, you know, Gombe State Governor is really working very hard. So I don't play lip service, and if you know me, I'll say it the way it is, but he's very, very proud of you with the great work you are doing for your people. And I want to tell your people who are in Gombe that you are very lucky to have such a governor, and trying to work so hard. And I believe that, and I pray, my prayer for you is that your legacy will be sustained, and people have seen what you are doing and even what the renewed hope agenda is at the center. You know, we didn't come here to play. I thought I was too old to be a first lady, but God has really strengthened me. I can tell you that God has really strengthened me to do the work. And that is why when God calls you to do the work, He would equip you, and He's really done that. I thought, you know, oh, I'm done, 65, but you know, God has renewed my strength, and I am promising you will do the necessary work and ensure that this nation, you know, is transformed truly. So on this note, I am really honored to declare the first Gombe Health Summit open, and I wish you all fruitful deliberations. Thank you. God bless you. God bless Gombe State, and God bless the Federal Republic of Nigeria. Thank you very much.
We thank you very much, ma'am. There's a health workforce book that was to accompany her official opening. Thank you, the First Lady. I'd like now to, that we have a health workforce policy that was going to be made public and presented. We'll present it to the governor, who will present it to the First Lady now. Please. Part of the documentation of things that are done quickly. Minister of Health, the wife of the Speaker, please join. Health Commissioner. From the royal community, we'll like to invite the Mayor of Kaltungo, Professor Idris Mohammed, please. Oh, thank you so much, First Lady. Can we please give our First Lady a very loud round of applause? She's always involved, she's always promoting anything that is sustainable. Thank you so much, ma'am. Others, please, to join the group photograph. Please, our APC woman leader and members of our entourage, please. Thank you. Other First Ladies? No. Other First Ladies, please. Thank you very much. The President of the National Council of Women Societies, please. The Permanent Secretary, Federal Minister of Health. The Directors General, please, DGNHIA, Executive Director, National Primary Healthcare Development Agency, National Blood Services, please, can you join this entourage? And that'll be the end. We thank you very much. Please, we will now have the national anthem. When the First Lady sets him back to her seat, we'll have the national anthem. And this formal session will be closed, but please, only those in the entourage of the First Lady are to leave. Every other person will remain in the hall, and the summit will continue. The national anthem, please.
Thank you very much.
The Deputy Governor of Gombe State will be leading us through the next phase of the Health Summit. The summit is on, the summit is alive. Please wait behind.